Okay, so home exercise program. So I want to preface this with, I do not give this page to anyone until I see what their muscles can do. I do assess everybody internally. I like to tell everyone that uh, I'll pretend that y'all are all women at this point right now because my verbiage would be different if you were a male. But I like to say that vagina is like a wine glass. So you have a wine stem and you have a wine bowl. And then the first layer of muscles is one fingertip deep. And then I can assess what those muscles are doing. Those are the muscles that are the vaginal wall, and they also squeeze at the urethra, and they start at the perineum. So if you've ever had any issues at your perineum for any reason, particularly childbirth, then it can change what's going on at these muscles. Then the muscles open up, and then there is the second layer of muscles, or the deeper layer of muscles. And then I see what's going on that side, anteriorly, posteriorly, right side versus left side. I usually check this on the first day laying down, but that's not where we're having issues, is it? We are not leaking while just laying on our back. Typically, it's as soon as we get up, it's as soon as we cough, laugh, sneeze, it's as soon as something else, but it's hard to assess those muscles any other way at first. So challenge your muscles to do more than they're used to doing. The quality of the exercise is more important than the number you perform. So if you can only do 3, then I'm only going to give you 3 to do. And if you can only hold for 2 seconds, then I'm only going to have you hold for 2 seconds. And so knowing what you can and can't do is going to be you need to be able to know that. And then it says to start lying on your back. I like that, but that's not, again, not where we have our issues. But it is cool to know, like, oh, I do feel those muscles. And then making sure that you're not holding your breath. So making sure that you are counting out loud to avoid straining. You're not using your buttock or your leg muscles. Coordinate your breathing with your pelvic floor. So this is something that I really like to teach someone in person, because if you are having issues with this, with Kegels, with leaking urine, then you're probably not doing this right. And that's whenever I'd be like, oh, let's try this, let's try this, let's try this. Because this is all I do is help people do this right. So quick one. So let's say that you could do 5 quick contractions. Then I would encourage you to do 5 times a day. So hold for a second, relax for a second. So boom, boom, 3, 4, 5, keeping your abdomen tight and maybe doing all 5 of those while you're exhaling, because that's how these muscles activate. Whenever you're exhaling, your breath is naturally allowing those pelvic floor muscles to push that air out of you. And whenever you suck in air, you let it fill your belly, fill your lungs, and your pelvic floor expands for that new air pressure. So endurance contractions, I never have anyone hold longer than 5 to 10 times, unless they're having issues with BM, and then I have a different recommendation. But as for urine, 5 to 10 seconds is just fine. Again, let's try to do those 3 to 5 times a day. So breakfast, lunch, and dinner, and hold for 10 seconds and relax for 5. So taking a big breath in, and that's whenever you're relaxing. And then as you let that air out, that's whenever you're pulling up those pelvic floor muscles and you're letting them help you get that air out of your breath. So then this isn't usually, or had been, the last page of my handout that I gave everybody. And then I threw in like my favorite things of, I just want everyone to know. So reposition during urination. So if you find that you're a strainer or a pusher or a try to pee fast person, then you may suffer from some degree of prolapse. And so knowing that you can just reposition whenever you go to the bathroom, maybe put toilet paper down there, stand up, sit back down. Oh, more pee came out, because the bladder like just shifts around, especially if you've had a hysterectomy or if you just finished pooping, like, and everything's just a lot more free and open and flexible. But do not bear down whenever you're pooping. You can bear down when you're pooping or when you're peeing. You can bear down when you're pooping. Push whenever you're having a BM. You can wipe, and then you can keep pushing a little bit more, and that can help clean up like any hemorrhoids or anything else. But you don't want to, as the anus is pushed out, then you can like clean a little better, and then make sure to like push it all back in and everything is tucked up there nicely after you finish wiping. So my favorite handout is the urge handout, which I mentioned that 8 seconds of steady stream is normal. Do your bladder diary. Keep your doctor informed. The more educated that our doctors get from us, then the more people can benefit from pelvic floor physical therapy. If a physician thinks that pelvic floor physical therapy isn't going to help, then they're not going to send anybody to it. And then there's all these people walking around peeing and pooping themselves whenever they don't have to. So I have on here, leave a Google review. I do have a 48-hour cancellation policy, and then I usually let people know how long I will write up the prescription for. I usually see people once a week, and I try to shoot for 3 months. Because in those first month and two, we're just retraining those muscles to activate whenever they're supposed to. I usually see everyone for 45 minutes and then out in the gym with our team members for another 15. And so letting people understand like what to expect whenever you come get physical therapy. Physical therapy does not have to be negative therapy. I will do whatever your body is going to allow me to do. So if you feel uncomfortable because you're on your period or you have tummy ache, then that's fine. But it means that I have a whole bag of tricks that I'll be doing. So you can still come to therapy if those things are an issue.